Hi, my name is Lorenz von Seidlein. I'm a pediatrician and I'm a professor of global health. I work at the Mahidol Oxford Research Unit in Bangkok, Thailand. My role in the Star Homes trial is that I am the principal investigator. The discipline of tropical medicine was really initiated to provide healthcare for people working in tropical countries that were particularly people working in colonial administration, the military. The centers for tropical medicine were consequently in ports like, for example, Liverpool, London, Antwerp, Hamburg. Now the situation is that we are not so much interested in travelers. There are still travel clinics, but the major emphasis of our discipline, global health, is to support the healthcare of indigenous populations in low and middle income countries, which includes a number of tropical countries. What are the differences in disease distributions between low and middle income countries versus high income countries? And I think we want to address this in two ways. One of them, the differences in populations. In low and middle income countries, generally the population under 18 years is large. Like, for example, in Tanzania, more than 50% of the populations are under 18 years of age. In contrast to a country like the United States, where only 22% of the population would be under 18 years of age. So what is happening that in the United States, the population that gets born basically survives over 5 years of age. Why is that? Because there are a number of vaccinations which have basically eliminated the most prominent and most prevalent infectious diseases which are still infecting children in Africa. In contrast to, for example, in Tanzania, the population is more a pyramid with a lot of children dying off before they reach the age of 5 years. Then there are the pathogens. So we have the population and the differences in population and demographics, and we have different pathogens. Leading are, of course, vector-borne diseases like malaria, which we are talking about here in our project. But there are also a difference in bacteria. So, for example, a bacterial disease like cholera, you would not find in the United States or in Europe, but there's still a lot of it in sub-Saharan Africa.